This is an introduction to some basic dental anatomy and terminology. On the top, we have the maxillary arch, and on the bottom, we have the mandibular arch. We start by dividing the mouth into 4 quadrants. When facing the patient, you start from the top left and move clockwise. This would be quadrant number 1, 2, 3, and 4. When naming the teeth, we use 2 numbers. The first number is the number of the quadrant, and the second number is the number of that tooth in the quadrant, starting from the midline. So this would be tooth number 1, 1, 1, 2, 1, 3, 2, 1, 2, 2, 3, 1, 3, 2, 4, 1, 4, 2, and so on. You can also call them by their double-digit numbers, names 11, 12, 13, 21, 31, 41, and so on. When you're looking at the surfaces, the most anterior surface is known as the facial surface or the buccal surface because it's closest to the cheek. On the inside, for the maxillary arch, we have the palatal surface, which is closest to the palate. And then on the mandibular arch, we have the lingual surface, which is closest to the tongue. We have a central incisor, lateral incisor, canine, usually 2 premolars, and then the molars. Sometimes there's a third molar, which is our wisdom tooth. From canine to canine, including the 4 incisors, these are known as the anterior teeth, and then premolars and molars are known as the posterior teeth. In terms of the interproximal surfaces, we have a mesial surface on each tooth, which is closest to the midline, and a distal surface, which is furthest away from the midline. For example, tooth number 12 is distal to tooth number 11, and tooth number 12 is mesial to tooth number 13. The incisors have incisal edges. The canine has 1 cusp, so it's also known as the cuspid. The premolars have 2 cusps, so they're also known as the bicuspids. The molars often have 4 or 5 cusps. Incisors often have a cingulum as well as a fossa. And posterior teeth often have pits with central grooves.